Coming up on today's show, we're going to talk to Dr. Alex Troncoso from Twin Health. He's the medical director, and Ray Holmgren, he is the vice president at Twin Health. We're going to talk about how their program creates the digital twin of your metabolism.
And now, America's healthcare advocate, Carrie Hall.
Hello, America. Welcome to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. You can find out more about us by going to the website, americashealthcareadvocate.com. 16 podcast platforms and the YouTube platform. We're on all of them. You can download these shows and listen to them. We've got a lot of people to do that. About 653,000, actually, last count. So there are a lot of you. We really appreciate what you do. And, of course, all of you out there listening to us on the radio at our 243 affiliates across the country, we greatly appreciate all of you. So today's show is going to be a little interesting. You know, I sometimes say that we separate fact from fiction, and we also talk about the latest technologies and advances in medical. Well, what if I told you that you could create a digital twin that would help you improve your health and make a dramatic difference in your lifestyle and how you live? Sounds like fiction? Well, it's not, and I'm going to tell you why. In studio with me today, Dr. Alex Troncoso from Twin Health and Vice President of Twin Health, Ray Holmgren. And we're going to talk about their program, Twin Health, and how they create a digital twin to actually help you in your health, especially if you're pre-diabetic, diabetic, any of those things, along with a number of other issues. We're going to tell you how you can do that, how it works, and what a difference it can make in your life. And you know what? I think it's so good that I've enrolled in the program. So, Ray, let's just start, okay, and talk about, what is Twin Health? How does it work? A little bit about it, how it was established, especially. Let's talk a little about your founder and his history and then how this all came about. Ray?
Yeah, so our CEO and co-founder, Jahangir Mohammed, he's a serial entrepreneur. Twin is actually his third company. He has spent his career in digital technology. He's kind of credited for creating the Information of Things platform. So he's spent his career on developing and leveraging sensor technology to better understand complex systems. And he set out, after he sold his second company, he really wanted to help people improve their health. And so he kind of said to himself, if I can build, a digital twin of these really complex systems, like why can't I build a digital twin of the human metabolism to help people live happier and healthier lives? So that's what he set out to do. So in a nutshell, we've spent the last 8 years developing our proprietary technology called the whole body digital twin. Essentially what that is, so I'll just explain digital twin technology. So it's been around for decades. So engineers who are trying to better understand a physically complex system. So think a self-driving car, a nuclear power plant, a jet engine, or even an airplane itself. Engineers are using digital twin technology with a variety of different sensors, gathering thousands of inputs of data, and using AI and machine learning to better understand the complexities of that system, to identify whenever there's an issue with that system and create improvements in near real time. So we're taking that same concept and applying it to the human metabolism. So when a participant enrolls in our program, we start off with doing a baseline lab assessment. We look at 50 different metabolic parameters. That's a very comprehensive lab work. So we're understanding at the biological level, like what is happening within the human, with each participant's metabolism. We then provide them a kit of sensors. So each participant receives a continuous glucose monitor. So this is a patch that you wear on the back of your arm or your abdomen. It collects blood sugar readings every 5 minutes. So our type 2 diabetic participants get really excited because they no longer have to worry about finger pricking, which is a huge relief for them. We also provide a fitness tracker. We have a partnership with Garmin. So the fitness tracker is really important because we're not just looking at a person's steps, but we're looking at their sleep data. We're looking at their heart rate variability. We're calculating their stress levels throughout the day. We give them a blood pressure cuff as well as a body scale. And the body scale doesn't just look at weight. It's looking at their visceral adiposity. So the
Okay, hold on a minute. We got to go back to say that one more time.
Visceral adiposity.
I can't wait to hear what this is.
Yeah, so it is basically the fat that stores around your organs. But we're looking also at lean muscle mass. We're looking at bone density. We're looking at your water weight. And so we're gathering over 3,000 data points for each participant every single day. And then we have our proprietary patented technology where we are able to predict and understand what are the interventions that person needs to heal their body.
So it's tailored to each person's need. This is not a size 44 overcoat. Here, put this on. We're going to take care of This is for, because everybody's different. And that's what you're saying here.
Everybody's metabolism is unique. And that's part of the challenge that we've seen in healthcare is that, we've spent decades throwing a number of different solutions, digital health solutions where, fitness trackers, all these things, but it's been, as the physician can attest, it's been generic advice. Like you go to your doctor and you hear
exercise more, lose weight, don't eat a lot of sugar. I can tell you what they are because I said I'm a participant in this program now.
Right.
Okay. I hear the same. I'm on the air. I got to watch how I phrase this. I hear the same things when I go, or here's the silver bullet. We're going to give you Wegovy. We're going to give you one of the weight loss drugs. Right. And my problem with that was, and I told you this last night at dinner, doctor, I'm like, that really sounds good in the short term. And then what happens when you stop taking it, or do you start this yo-yo thing? And then there are no studies that are 10-year studies that say, what are the effects of this medication 10 years from now? And what do you do at the end of the year when you've run the course? Do you stay on this stuff for a lifetime? You stick a needle in yourself for, I don't know. Okay, but I walked away from it. I'm like, I'm not doing this. So your thoughts?
Right. So obviously GLPs are a hot topic these days, to say the least, among employers, among health plans. And, one thing I'll say is that we think that GLPs are actually a good tool. Okay. We think they can be a good tool to help improve A1C and lower BMI. But we don't think that the GLPs are for all patients for the rest of their lives.
Right.
Okay.
And that's not how they're being advertised. They're being advertised as the silver bullet. Every damn ad you see on television, on radio, it's the same thing.
Correct. I would say many providers, primary care, nurse practitioners, the prevailing guidance has been, we'll start you on the medication, but they don't really talk about what happens eventually. Do you ever come off the medication?
Thank you.
So there's really no kind of discussion towards that end point if there is one. And the studies have shown that over time the efficacy of these medications does go down.
Yep.
Okay. And also after about a year, many people have stopped taking the medication anyway because of various reasons, side effects, cost, a number of other things. So, at Twin, we help to give these patients an off ramp so we can sustain the weight they've lost on the GLP and even get them additional weight loss while deprescribing the medication on the Twin program.
So you can actually, you're not against it, but you're managing in such a way that it is a solution as you move to a life-changing event where people start to live their lives differently.
Correct.
I mean, I look at some of the things that I read that people are saying. You changed my life. You gave me more years. You saved my life. That's pretty strong.
Yeah.
I mean, I'm 76 years old, soon to be 77 next month. Okay, and I've got 6 grandchildren. I intend to be around for a long time.
Yeah.
Okay. So to me, when I see that kind of thing, I'm like, this really can make a huge difference for people, and I think it will make a huge difference for people. The problem is getting the message out there and getting employers and brokers and people to understand this. So we're going to come back from the break. We're going to talk about why is metabolic disease such a big deal? Why is it so hard to manage? Why do we keep struggling with it? Well, doctor's going to talk about that, okay? So we'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting coast to coast across the USA. If you want to learn more about this, they've got a fabulous website. It's called twinhealth.com. I was up on it again this morning. When I did all the show notes last week, I was on it. It's a remarkable site. There is a place in there for brokers, if you want to reach out to them, and employers, if you want to reach out to them. There's a way you can do all of that, and you can learn more about this. Once again, the website is twinhealth.com. Stay tuned. We'll be right back after the break. Doctor's in the house. Stay with us. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA on the HIA Radio Network. I want to say hello to our affiliate in Anchorage, Alaska, KBYR, Anchorage, Alaska, AM 700. I've been on the air for quite a while up there. Been to Anchorage, love that part of the country. It's great up there. Glad to have you as part of our family. Doctor, let's talk about why metabolic diseases are so critical. And the other piece to that thing is, along with diabetes and all the rest of it, is the number of people in this country that are obese and morbidly obese. We're looking at numbers close to 70%. That all, so kind of paint the picture of how all this kind of comes together, Doctor.
Right. Thanks, Kerry. And you are right. You know, the prevalence of obesity has gone up significantly over the past several years. And that in itself is a predisposition to the whole spectrum of cardiometabolic disease. And I think one of the mistakes that people tend to make is to try and separate these diseases out into specific conditions per se, when in reality, this is all kind of under the umbrella of cardiometabolic disease. And it's really a spectrum of something that starts, in our younger years and really kind of progresses consistently throughout our lives until we start to show symptoms. And this is kind of where traditional medicine, in my opinion, has started to fail us, because the model of medicine right now is a more reactive model. It treats a symptom or a condition once it has presented itself.
Correct.
Which in certain ways makes sense, but at the same time, by that time, the damage a lot of the time has already been done. Okay. So what we try and do, as opposed to, going to see your primary care doctor 3 or 4 times a year, having them adjust a medication, add a medication, see you in 3 months, we try to do more of a continuous care model where we, join with the patient earlier on, in their course, and really identify what's going on with their metabolism using our sensors, and we combine the data that we get from our sensors with a live care team that includes physicians, nurse practitioners, nurses, and health coaches, and we really try and treat the whole person again on a more consistent basis so that we can help to improve their overall metabolic health.
So what you're really trying to do is on a day-to-day basis, get them to change their lifestyle.
Correct.
And so this was amazing at dinner last night. So we're at dinner last night, and I'm talking about the phone app, because the phone app is really cool, right? And when I first talked to Ray and we talked about this, I said, well, the problem with all these programs, the program I was in over at the weight loss clinic I was in, where I lost 20 pounds, got myself where I am, and I've held. But the point is, you have to, if you're really going to manage it, you have to go through and what did you eat? How many calories? Here's the list. Well, Ray says, well, you don't have to do that. Well, what do? Oh, you just take a picture of the food. So last night at dinner, he takes a picture of grilled octopus, and this is never going to be on there. Lo and behold, it came up. Ray had it showed the grilled octopus, how many calories, what it was going to do. And the same thing he had ossobuco, and it did exactly the same thing. The part that was fascinating to me is that information's in your system now, and it's going to tell you your A1C is going up here while you eat this stuff. You can eat it, but here's what you need to do to offset. So talk a little, because that's this whole thing with day to day is it's real time right now.
Right.
And it's not a pain in the neck to do. You're making it simple enough that people in my age, the number 2 pencil in a.com world, are able to do this kind of stuff. So talk a little bit about that.
Sure. So that kind of goes more towards the personalization aspect of the program, which we think is kind of one of the cornerstones of the Twin program. But basically, everyone's metabolism is different, and everything that you do from a dietary, medication, activity, sleep, stress standpoint affects each person differently. So, for example, with the foods there, as we build their digital twin and get more data points on each patient, we can build every day it gets more and more accurate. For example, if the octopus that Ray had last night.
Yeah, which I didn't eat, by the way. Thank you.
It was very good.
I'm sure it probably was. That's a little stretch.
So the octopus that Ray took a picture of yesterday, that went into his algorithm through his app, and the app told him, okay, you're having grilled octopus with chickpeas and an aioli sauce. If you eat this, your glucose will go up by this amount. Okay. And we're not going to tell you that you can't eat something. We'll tell you you can eat what you want to eat, but we'll give you options or ways to help mitigate the quote damage from that particular meal.
Right. But so you're managing it in real time. Mm-hmm. This is not, okay, I got to go fill out the chart, then I got to look at the chart, then I go back and what was my day's activity? This is all being fed into this system, this twin digital system that you've created for me, mm-hmm. specific to me and my needs. Okay, you ate that in my case, let's say it's a Friday and I've had just a slice of coconut cake. And it's going to say, now that you ate your coconut cake, you need to go walk around the block for 10 minutes or do something to offset what you did. Doesn't mean you can't do it, but there's a way to compensate for it. So you're disciplining yourself to do it. It's okay to do it, but here's what you need to do to offset that that's going to affect your A1C. So you're really enabling people in real time to manage this, which is something that's never been done before. I mean, look, I've been battling pre-diabetes for I don't know how many years, and I've never allowed myself to get to type 2 diabetic because it scares the hell out of me. But having said that, I never saw a tool like this. Right. I mean, real-time data that's going to tell me, hey, guess what? You can eat that, but you better do this or this or this.
Yeah. And that's two important points that you bring up. You know, I think that when a program or a diet is restrictive, that makes it very hard for the person to follow. Okay, so that's the first thing. And the second thing, we try to let them eat whatever they want, but give them those options.
Correct.
In terms
but it's self-correcting to a certain degree.
Real time.
I mean, you're going to do this, and then you're going to go, do I really want that second slice of cake?
Correct.
Probably not a good idea. I mean, it's helping you. What I see here, and I've been a health insurance broker for 27 years, and I asked this question last night, and you hit it right on the head. I said, what's the percentage of people you think participate in a wellness program? And we've done hundreds of them over the years with our employer clients and that we were working with. And you hit it on that. You said 10%. I said, yeah, 10% is what it looks like. We're lucky if we get 7. So you can put as many programs out there as you want, but if people don't use it, it doesn't mean a damn thing. The beauty of Twin Health is it's right there in your face. And if you really want to you really want to be healthier, you really want to live longer, you really want to have a different lifestyle, we're going to help you make that happen, is what you're saying. And it's actually quite remarkable the way that it works and it all comes together. So we're going to come back after the break. When we come back from the break, we're going to, if you think you're listening, you just think, this is a lot of hoodoo voodoo. Well, we're going to come back and tell you about a study at Cleveland Clinic, right? It actually verifies everything we're talking about here today. And if you're a broker or an employer, you're talking about cost containment and claims issues, you better listen to this next segment. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting coast to coast across the USA. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. In studio with me, Ray Holmgren, Vice President, Twin Health, Dr. Troncoso. He is the Medical Director at Twin Health. We're talking about the Metabolic Twin, the program that they make that fits your needs, and helps you change your path in terms of life expectancy, enjoyment of life, and what they can do to get, if you're pre-diabetic, diabetic, this is a program that can change things and make a big difference. Now we're going to talk about a study that was done that I think is really important here. We're going to talk about a study that was done by Cleveland Clinic, and I think that really kind of defines and the credibility that it gives to Twin Health is actually remarkable. So, Ray, let's talk about this, because when I saw these numbers, I was like, you know what? If you're an employer or you're a broker and you want to know if this really works, this is the icing on the cake that proves it does work, Ray.
When we set out, like, anyone can go to our website and see our commercial outcomes, but it was really important to our founder and our chief medical officer to be able to validate with a world-class clinical institution like Cleveland Clinic that we're putting our money where our mouth is and we can actually deliver on these outcomes. So we partnered with the Cleveland Clinic. We published a study in the New England Journal of Medicine Catalyst, which anyone is welcome to check out. The trial was completely conducted by the Cleveland Clinic with their endocrinology team led by Dr. Kevin Pantalone. They did the randomization, so they used their own patients. They were seeing a Cleveland Clinic physician out of Twinsburg, Ohio, which no pun intended. But they selected their
own. You picked that on purpose.
That was all them. So they ran the trial, they did the study design, they did the randomization of their own patients. They randomized 150 patients, 100 participants into the twin cohort, and 50 participants just continued to receive usual care. Throughout, it was a 12-month study, and the primary outcome was to see, to determine twins' ability to, reverse type 2 diabetes among the type 2 diabetes participants, which the Cleveland Clinic defined as having an A1C less than 6.5.
That's the one.
And while simultaneously eliminating all medications, anti-diabetic medications with the exclusion of metformin. So we looked at diabetes reversal, we looked at weight loss, and we looked at medication elimination. I'll start with the usual care group. So in the usual care group, only 6% of the participants reversed their type 2 diabetes. They had 14 pounds of weight loss at the 12-month mark, and medication usage actually increased by 6%. In the twin group, 71% of participants normalized their A1C while simultaneously eliminating all anti-diabetic medications with the exception of metformin. We saw twice the amount of weight loss as the control group at about 24 pounds. And then we also eliminated over 80% of anti-diabetic medications. What's really interesting too is that when you look at GLP-1 medications alone, we eliminated 85% of GLP-1s, which is really important. So not only did we achieve double the amount of weight loss as the control group, but we did so while simultaneously eliminating GLP-1s.
Doctor, when you look at this and the effect of this, okay, the weight loss, GLPs are weight loss drugs for all you people who don't know what that is, but you should. But anyway, that's what they are. When you look at this overall, and one of the biggest problems with diabetes, and this goes right back to brokers, claims, and employers, and human resource directors, is the comorbidities. So when you're doing this, not only are you moving them back from type 2 diabetes to not type 2 diabetes to regular, normal, no issues, okay? But what about all the comorbidities that are going away? Because this is when we talked about this dinner last night, and it's like, well, employers, we need to measure this, and employers, there's this and that, and so, wait a minute. What about, the issues that come along with diabetes that are comorbidities? They have the highest number of, you go to any plan, at the Tego, we've got, 200,000 people on various plans that are, our TPA runs. You go through the list, the top claims number across the board centers on diabetics, period. So talk about the comorbidity issue and how this does a lot more than just cause you to lose weight, okay, and get you off the weight loss drugs. Talk about that.
So, part of the study, the main focus of the study was to treat diabetic and pre-diabetic.
Correct.
But, within that, we also wanted to make sure that we were not causing any, harm to any other systems in the body.
Right.
So not only did we not cause any harm to any other systems in the body, but we really improved numerous other biomarkers across the board, during that year of the study. So for example, hypertension was normalized in 2/3 of the study participants. Cholesterol was normalized in over 70% of participants, and fatty liver disease was improved in over 85% of the patients. And that was actually verified directly through MRI. And not to mention improvement in kidney function, as well as a decrease in the Framingham risk score, which is the likelihood of a cardiac event in the next 10 years. So it really has shown not only that we're improving the type 2 diabetes and helping with the weight loss, but also helping a lot of these other adjacent conditions, again, which people were thinking are, separate conditions, but really are kind of part of the same metabolic umbrella.
And Ray, when you dial that in and you look, to me, when I look at that, I'm an employer or I'm a broker or I'm a human resource director, and I've got, 27% increases every year, 30% increases. I've seen numbers as high as 37 and 40% in some of these level premium plans that are out there, which depend on your claims numbers. Yeah, it looks really good for the first 2 years. Then it blows up in the third year and you get 100% increase. Yeah, you can renew, but look what, so what do people do? They move off and they jump over onto the various plans that are set up by the government through the regulatory process that are not those kind. In other words, the Obamacare plans, if you will, or the ACA plans. So this is impactful. And I think that's a message that really needs to get across, because you're not just dealing with the type 2 diabetes. You just listen to what doctor just said: fatty liver, blood pressure, cholesterol. Mm-hmm. Hello.
Right.
Okay. I mean, I'm going to be thrilled if I can get off blood pressure medicine that I've been on since I was 23 years old. Yeah, I'm probably going to be pretty happy about that. Okay. Yeah. Same thing on the cholesterol side. If I can get off the cholesterol med, I'm going to be thrilled. Right. So I'm the employer. I got 300 employees in the top, and I got 30 people in this company that are driving claims through the roof. And of those, 20 are diabetic.
Right.
Duh.
Yeah. Think
it might make a difference.
Sure.
Yeah. So to me, when I look at this, it's the effect of the overall program, and how that works and how that translates back. Is that a reasonable interpretation?
Yeah, I mean, that's what we hear from our members. It's what we hear from our employer partners. It's what we hear from our payer partners as well. Everyone has, again, spent several years dealing with point solutions where it's either generic advice or they're really focused on helping participants live with their condition and manage the disease. And a lot more employers and brokers and payers are looking for solutions that can actually improve someone's health outcomes and actually make a difference and improve weight loss, lower A1C, and most importantly, eliminate those high cost medications.
Well, you said it in the previous segment. We're treating the symptoms. That's correct. The way typical medicine works. I have a lovely, fabulous primary care physician. First thing she said was, well, let's get you on Wegovy. I'm like, no, I don't think so. They're going to pass on that one. Okay. But that's the mindset. That's not a solution. Right. That's a Band-Aid.
That's the way the healthcare system is built today, right? Because they don't have the infrastructure to monitor and manage these patients as closely as we do. Okay. Your primary care doctor could never monitor your CGM, your glucose monitor numbers, 24 hours a day, 7 days a week, and make adjustments to the medications every few days based on, what your glucose numbers are showing. But we can do that. So you're not seeing the doctor 4 times a year, you're seeing them 4 times a month sometimes.
Yeah. So if things are starting to work, instead of taking metformin in the morning and metformin at night, maybe you're only taking it in the morning. Okay. And then maybe you get to a point where you're not taking it at all, but you have created a behavioral change. The thing that I think that needs to really get across to the audience here is this is not a one and done type of solution like the weight loss drugs and some of the other things are. This is a behavioral change that's going to change the way you live your life. Am I correct in that assumption?
Absolutely. And it's something that we want to give the members that is sustainable, right? Because, after you can only be on, for example, a keto diet for so long before you relapse. You can only be on a GLP for so long before it stops working. It's really a matter of changing the behavior of the individual and having them see how certain external forces affect their own body. And once they see it, they're the ones that have to make the change.
That changes everything. Yeah, because you're putting it right back in their lap and they're able to see significant results, which then translates out to a healthier group of employees and translates out to lower claims across the board. You're interested in this, you're listening to this, you think, that maybe I ought to take a look at this. If you're a broker and you really want to introduce something, and we're going to talk about how this gets set up, you're going to be surprised to hear there's no out-of-pocket cost on this to get it in the door. We're going to tell you that in the next segment. Go into it, but go to the website, twinhealth.com, twinhealth.com. It's a great website. There is a ton of information up there. I urge you to take the time to look at it and then reach out to these folks and see how they can help you and what they can do to make your book of business better. And if you're the employer or the HR director and you're concerned about where your costs are going, this is a great way to get them under control. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting here on the HIA Radio Network, coast to coast across the USA. Doctor's still in the house. Don't go anywhere. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. You know, you're listening to this. Maybe you're the HR director and you want to go to the boss and say, hey, this is something we need to take a look at. This might make a big difference for us. Or maybe you're a broker and you've got a client where this thing is going through the roof. You want to go tell somebody about this. You can go to the podcast. You can go to the YouTube. It's all right there. Send them a link so they can watch it or listen to it, and they'll understand what you're talking about. You don't have to go through and redo everything we're saying here. You can do that, and it would make a lot of sense to you. So that's one reason why we have 653,000 downloads, is because people are doing this. And I'm urging you, if you're that HR director, if you're the employer, if you're the broker, this is a tool you want to take a look at. So let's talk about this, Ray. What does it cost? Okay, how do I implement it? And how much trouble is it going to be for me to do this if I'm the HR director, the broker, the employer? Ray?
Yeah, so when we came to market and we asked our earliest partners, like, what do you want to see in an economic model? And the overwhelming feedback from employers, from payers, from everybody was, we're frankly sick and tired of these digital point solutions where it's a fixed PMPM or PEPM where we're paying a monthly subscription that it's not really dependent on delivering on any outcomes. As long as the person opens an app or stands on a weight scale, like, they deem that as an active participant and they get charged on a monthly basis. So we said, fine, we will put all of our fees at risk. So for an employer or for a payer, Twin Health only gets paid for participants who are actively participating in the program and for Twin achieving and sustaining clinical outcomes. So we only get paid for successfully improving each participant's blood sugar, A1C, and it's a monumental improvement. Depending on when their baseline A1C is at the start of the program, we have to reduce their A1C by at least 2 points or get it below 6.5 in order for us to earn any fees. We also earn fees for each 1 point reduction in BMI, and we also earn fees for 100% eliminating a high-cost medication. So we will eliminate other medications, but as long as they're high cost, that's how we earn fees. We don't get paid on reducing medications. They have to be 100% eliminated and sustained. Thereafter, once we achieve the outcome, as the member continues their engagement and they continue improving their health outcomes, we continue only getting fees for proving to the employer or the payer that we're actually sustaining the outcome. So if the participant disengages, they quit talking to their care team, they stop wearing their sensors or opening the app, or if their health declines, we can no longer earn any additional payments on that participant. So we're really only getting paid for driving measurable outcomes at each individual participant. And all of those outcomes are directly tied to cost savings for the employer and the payer.
So how do you relate that information back to the employer, the broker? So they've got 100 employees, whatever it is, and 30 of them are either diabetic or pre-diabetic. And of that, 20 enrolled in this program. And so each month, are they getting a report that's anonymized that says, this is where we are, here's what we're seeing? And how does that work? How do they see that you're measuring what they're paying for?
Yeah, exactly. So we will provide, each program sponsor will provide them, with a report of a anonymized list of each participant in the program and the outcomes that we've achieved. And then in addition to that, we perform consistent reporting throughout the year. So we do quarterly business reviews where we're not only doing a population level, aggregate report on the population on A1C improvements, BMI reduction, and men elimination. But what our employers love is that we're also reporting out on those comorbidities that we discussed before. So everything that was included in that Cleveland Clinic study was intentional because those are the same comorbidities that we report out on for every single one of our partners.
You know, it is remarkable because when I look at this, you're talking about blood sugar regulation, insulin sensitivity, body composition, liver function, blood pressure, cholesterol, inflammation, kidney, and cardiovascular. Mm-hmm. Doctor, that's a remarkable list. I mean, if you had half of that, you've really made a difference in people's individual lives and for the workforce.
You know, what we've seen so far, I work personally with a lot of the members, and I've seen significant improvement in their A1Cs, in their BMIs. I have, I have a number of meetings, video calls with them as part of my clinical duties every week. And I really can kind of follow them and track them as they move through the program and as their metabolism improves and as their numbers improve. And the feedback that we're getting, from them is all very positive, and they're super appreciative of, the results they're seeing on the ground.
I got to think, Ray, that because I've seen other programs that are not like this. They're focused on different things, but I've got to think that these people are going to come back to the employer and go, "I really appreciate what you did here. Mm-hmm. This really made a difference." I would imagine that positive feedback that I read, "You've changed my life," that's got to reflect back to the employer. Like, you know what? They really give a damn. Mm-hmm. I mean, am I right or wrong?
Yeah, I mean, anyone can go to our website. We actually have a section on our website where it's just full of member testimonials, which
I watched
like you stumbled upon.
Yeah,
but that's just a small slice and sample of the impact that we're having at Twin Health. So it's a regular occurrence where, the account manager for each of our clients, like, will get pummeled by, member testimonials. And
it's a good thing, not a bad thing.
It's a great thing. And again, as you said, like, I have yet to see a member testimonial where the participant hasn't said, like, in some way, shape, or form, like, Twin Health has changed.
It's made a difference. I do these shows for a reason, okay? We try to bring you information, cutting edge information, and what's going on in medicine and in health that's going to make a difference and change people's lives. This can make a difference. If I didn't think so, I wouldn't be enrolled in it, and I am enrolled in it, and I'll be talking about how it goes as I stay in the program. But I'm urging you, if you're an employer or you're an HR director or you're a broker or you're a partner in a company, whatever it is, go to the website, twinhealth.com. Take a look at it. You really want to make a difference? You want to lower your claims costs. You want to improve the health of your employees. You want people that are going to be loyal and want to stay with your company because you're doing something different. That's what this can do. It's twinhealth.com, twinhealth.com. And now I leave you with this thought from Dr. Albert Einstein. The one who follows the crowd will usually get no further than the crowd. The one who walks alone is likely to find himself in places no one has ever been. Remember, friends, it's a funny thing about life. If you refuse to accept anything but the very best, you most often get it. Thank you for listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. Goodbye, America.